Right.
And so I have to ask you, this is just because I'm forced to do this. My niece got SARS-CoV-2 when she was 4 months old over Thanksgiving, made me sick, made my parents sick, and made everybody around her sick. It was totally nothing for her. Her parents were much younger, in their 30s. It was a cold for them. But now they're in the quandary, which I think is the question that we really need to answer. Should that child, she's now 6 months, 7 months, should that child receive any COVID vaccines?
Right. So the answer to the question, can natural infection protect against severe disease associated with the re-exposure, is yes. I mean, there are many studies that have shown that. I'm not sure what the story is would be with a 4-month-old. I mean, that's a much younger first-time infection than typically. There are studies also that have looked at, if you look at people who've got naturally infected and then not given, say, any vaccine as compared to those who were vaccinated and given a vaccine, there is an advantage to getting the vaccine. And so I think probably the best overall study was by Chen and coworkers out of Harvard, published in Science Immunology. We're probably the best vaccine, best situation in terms of longevity and breadth of immune response is either 3 doses of an mRNA-containing vaccine or 2 doses of an mRNA vaccine in natural infection. So were that my child, I probably would still give them 2 doses of an mRNA vaccine at some point to give them the best, longest chance of protection against severe disease.
Okay. So at least one. And how far apart from the natural
At
infection?
least 4 months later.
At least 4 months later. Okay. And if they do at least one, you're probably good because that will prevent death.
Yeah, I think
Uh,
that's what, well, the Chen study suggests a sort of 2 and 1, meaning natural infection plus 2 doses, but I think it's 1 dose will also certainly offer.
okay.